So what I'm going to do first is talk about why it's sometimes quite common to see a duty to avoid causing harm or a duty to avoid depriving as a fairly simple or straightforward duty, and then talk about the ways in which that actually, even at the level of theory, in general and fundamentally, it's much more complex than we sometimes might be inclined to think. With reference to Judith Lichtenberg's idea of this new harms, and how that relates to questions of structural injustice and relationality between persons in a global context. And having done so, I'm then going to move on to talk about the situational complexity of uncertainty and disagreement in any given particular context as it relates to COVID-19. So I'm going to try and explain how this relatively simple, straightforward idea of don't cause harm to people is actually a lot more controversial or a lot more complex than we may initially think, and how we might do something about it. So when I say that it's often seen as a kind of straightforward or simple duty, I'm referring to a lot of different ethical codes and the way that this is framed as a core or baseline responsibility. So it's very prominent in ethical codes relating to medicine. We have first, do no harm, prima, non nocere in the Hippocratic Oath and its many variations. Nonmalevolence is present is one of the four principles of biomedical ethics, and while this is not an uncontested methodology for doing bioethical reasoning, it is very prevalent and is highly influential, and it's present in a lot of discourse surrounding the kinds of questions of responsibilities to other people. It's also present in a number of different frameworks. So what we have on the right-hand side of the screen there is Henry Shue's model of a triumvirate of duties. So we have a duty to avoid depriving, to protect from deprivation, and to aid the deprived. And that framework works it is, according to Shue, what is necessary for us to be able to enjoy any rights to anything. So in many ways, a duty to avoid depriving or to avoid harming is seen as sort of fundamental to our responsibilities to other people. We might have disagreements about what our rights are. We might have disagreements about the extent to which we have to help other people. But often this duty to avoid causing harm or to avoid impeding other people's rights or to avoid depriving them of their rights is seen as an uncontroversial, not even a compromise, it's just an accepted thing. It's quite hard to think of an argument that it is acceptable or it is reasonable to cause harm to other people. And even in the ever fraught political debates surrounding universal healthcare and health insurance in the United States, the argument is often put forward, well, I'm not preventing anyone from getting access to care, so I'm fulfilling my responsibilities to them. There's a free market, anyone can get access to care if they want it. So this idea of do not cause harm is in some political debates framed as a very simple and very basic responsibility that isn't controversial. Of course, as we all know, there are many different ways in which we each individually and collectively impact on the lives of other people, deliberately or non-deliberately. So the non-malevolence condition doesn't encompass everything that might happen in a way to cause harm or to deprive people of their rights. So while there is now increased awareness that this idea of the individual carbon footprint or individual responsibility to curtail carbon emissions is largely a result of a PR campaign by the petrochemical industry, it does remain the case that if we fly regularly, if we consume resources to an excessive degree, we are going to have an impact on the climate, we are going to impact on the lives of other people, even if we can't necessarily measure specifically, well, this flight on this day had this particular impact on that person. It will contribute to a general context in which harm is caused. Similarly, how we consume antibiotics, if we're consuming inappropriately, we may be contributing to antimicrobial resistance, and refusal to participate in vaccine programs can also contribute to an increased level of risk for people in our community. More generally, we also live in a globalized economy now, and how we consume individual resources or how we engage with different employers or different corporations can have a profound effect on people who we may never know, we may never think about, we may never meet, or we may never have any awareness of the harms that we may cause. And so this is discussed by a number of theorists, but wonderfully by Gillian Brock in her book Global Justice, where she talks about the various different ways that different corporations can behave perhaps less than ethically and in ways that which deprive people of goods that they might be entitled. So we can cause harm to other people through a number of different ways, inadvertently, without meaning to, without knowing that we have. So if we think of, for example, a generic online international retailer who has perhaps, purely hypothetically, terrible employment practices or unethical business practices, then if we are engaging with that an employer or corporation, we might be contributing to the harm of employees or to the nations in which that employer is based. Judith Lichtenberg describes this as a sort of as the idea of the new harms, and that this idea of avoiding causing harm to people isn't as simple as just simply not assaulting people. So the malevolence criteria way of harming people that she identifies, but she also talks about this idea of negligence and partiality. And so malevolence is those obvious examples of murder and theft and violence or vicious action. Negligence, though, is more complicated, but it involves those kinds of cases where we don't intend harm, but through carelessness, we cause harm to other people that we should have predicted it was easily avoidable, and we allowed harm to come to other people because we failed to act appropriately. Partiality is similar, except where negligence occurs as a failure to take account of the relevant risks. Partiality occurs because we discount the impact, the people on whom those risks are inflicted. So it's exclusionary or inequitable policy, or in the COVID context, vaccine nationalism. So from these ways in which harm can be caused, we can derive a number of conditions of a duty to avoid depriving in general. So we have the non-malevolence, as we've already said, but also conscientiousness. So that's being careful about appropriate guidelines, thinking about the consequences of our actions. If for an employer, making sure that working conditions are safe, taking appropriate steps to ensure that the situation is not likely to harm employees or people who are using the service. And then impartiality, and this is the requirement more generally that we recognize the equal status of persons and don't act in ways that will benefit a preferred group by causing harm to a non-preferred group. So even at this sort of very general level, we have a broader set of obligations than merely not acting in vicious or violent ways towards other individuals. We have to actually actively engage in conscientious behavior. We have to actively make sure that our actions are impartial in order to ensure that we're not causing harm to people. So even at the general level, we have this much broader, more active, less passive set of obligations under a duty to avoid causing harm or to avoid depriving. As it relates to COVID-19, then we can think of different ways in which these three requirements might function. So in the case of non-malevolence, again, relatively straightforward, avoid deliberately exposing others to risk of infection. So that, and those are, almost kind of trivial claims. Don't cough on people, don't go places without a mask on, don't deliberately expose oneself to risk, and then deliberately attempt to expose other people to risk. In terms of conscientiousness, everyone in the UK has probably seen this poster everywhere, this idea of hands, face, space. Wash your hands, wear a face mask, and maintain social distancing with other people in order to minimize the risk of infection. And that's an active process. That is something that we actively have to do. It is something that involves cooperation with others so that we can maintain social distancing. It is a deliberate process that isn't about not acting viciously. It is taking conscious steps to protect other people or to avoid depriving other people. And then the impartiality condition, that can occur at the level of individuals. So yes, it is not fun to not be able to see one's family and friends, but if one breaks lockdown to do so, one may expose other people to risk and is therefore prioritizing one's own benefit, one is being partial towards the group of people with whom one is socializing, but exposing other people who aren't in that group to increased risk and potentially contributing to the extension of the current situation. We might also see this in terms of providing furlough schemes and adequate support systems for people who might be exposed to risk through employment or through other systems where they have to work or may be able to work from home. So this is a way to support people who cannot do their job from home and avoid being deprived by being exposed to risk. And then globally, we can look at things like TRIPS waivers are a way of acting impartially so as to benefit vulnerable people who might not be able to afford vaccines under the current cost pricing system. As I'll mention later on, this is actually kind of in our own in the interests of wealthier countries as well, but we'll come to that in a moment. And this, so in terms, when I talk about situational complexity, this is the unique features of particular circumstances that can make a duty to avoid causing harm even more complicated. So I've already mentioned that in general, avoiding harming people is more complex than simply refraining from violence. In the situational complexity, what we're talking about is how individual circumstances of a particular novel situation might make it harder for us to fulfill that duty as well. So the first type of problem is this idea of an uncertainty problem. We might not be quite sure exactly how to avoid causing harm to people. And this is present at the start, in the start of the pandemic. Jonathan mentioned the differential timings of border closures, when there was disagreement about the best way to avoid causing harm or the best way to protect people. And so there's an uncertainty there about the best method of response. There's also an uncertainty over how to prioritize different goods and different responses. So if we avoid causing harm in way X, we might be causing harm in way Y. So this is the prioritization of responding to COVID by a necessary response, but that does potentially mean that we're not responding to other risks of harm to health, such as cancer treatment or mental health. So there's this live discussion about, well, how much priority should be given to the different causes of harm? Because if we avoid causing X, we might inadvertently cause Y or allow Y to happen. The second type of problem is we can think of as a controversy problem. And this is, I think, more complex, more challenging. So this is the kind of, there is no risk of harm, it's fake news, it's a conspiracy, there isn't any obligation for me to minimize my risk of harm to other people. So this is a harder problem to deal with because there isn't a shared understanding, there isn't an appreciation of the risk, or there is a fundamental denial of an obligation to avoid causing harm to people, or that there is any need to do so. So the first kind of problem we can think of as a principled agreement, but practical uncertainty. And here we have this agreement that something needs to be done. We need to prevent the spread of this of a particular threat in this particular situation, but it might not be entirely clear, at least initially, what the best method of doing so that is. So we have social distancing, we have face masks, but there is also this concern about perhaps there's also a worry about economic harm or the lack of access to cancer treatment, for example, or these other impacts. And so we end up with situations like the Eat Out to Help Out scheme, which perhaps other people will talk about. I won't go into any detail here, but there is a disagreement about, yes, we need to do this, but we're not quite sure how or what priority we should be giving it. The second kind of problem is much more challenging because there is no shared epistemic foundation. There is no shared agreement that anything needs to or should be done. And so we have examples of this in a number of different ways. On the left-hand side of the screen, we have the example of Lawrence Fox, who recently did not get elected mayor of London. And he has consistently refused to acknowledge there is any risk. He's denounced the idea of face masks. He's claimed that it's a fundamental violation of his freedom. It's fundamentally important to socialize. This tweet was during the November lockdown. And this is not an isolated incident. There are people who have consistently refused to acknowledge that there is any risk, or that any obligation on their part to engage in behaviours to protect or avoid causing harm to other people is some massive violation of their rights to freedom. We also have Dominic Cummings, who drove from London to Durham, who again during a lockdown, and then the person in the middle who bought about 18,000 bottles of hand sanitizer in an attempt to profiteer off a situation where people needed hand sanitizer. He was then unable to sell it and eventually did donate, or at least sell it at cost. And then we have the two people on the bottom right-hand corner of the screen who have, at various times throughout the last 15 or so months, have denied that there's a problem, have minimised risk, have flouted conspiratorial ideas, or objected to media reporting which has accurately reflected the situation, or have suggested that there isn't as big of a risk, or that other things are more important. So we have this situation where there is the lack of agreement that there is something that needs to happen, or that any obligation to others is reasonable. With the first problem, it's relatively easier to understand or to address, because there is that shared epistemic framework, or a shared understanding of a problem. There is at least a method that this can be approached, and that's either through scientific discovery, public debate, political responses, policy responses, so that resolving the uncertainty of how we should do something is much easier. It might not be quick, but it is something that can be achieved, and Jonathan has discussed this. The second kind of problem is much more challenging, because we do have this issue of, if there is a lack of a shared understanding, there isn't the shared language to develop an appropriate response. And so a couple of years ago, I co-authored a paper on global health solidarity, where we suggested that a recognition of a self-interest, or a fear over various different global threats to health, such as climate change and pandemic disease, might be a way of engendering cooperation between persons. Excuse me. And that this is a way of encouraging people to recognize that they have similarities with other people, and that this could encourage solidarity and the fulfillment of obligations to people who may not have access to those benefits, but because of a shared interest in doing that. The last 15 months have kind of shaken that belief that might work for everyone, because it seems that it is not the case that is a compelling interest, when people don't even recognize that there is a shared interest in responding to a pandemic. So we have one way of responding to uncertainty. It is much harder to challenge a certainty in an alternative epistemic set of commitments. However, to return to Henry Shue's model, he emphasizes that those three duties are not necessarily any more or less important than one another, though he does say that at certain times they will have different kinds of priority. The problem is that a failure to fulfill a duty to aid, or a duty to avoid depriving, rather, or a duty to avoid causing harm, can lead to, in his words, create virtually Sisyphean duties to aid the deprived. And this is because the failure to avoid harming people can lead to much greater problems in the longer term, which are almost impossible to resolve. Thanks very much.